Yes, you're most welcome to this week's edition of International Desk, where we bring you events of significance important. For some time, we have been discussing political and social issues, sports inclusive. But this week, our focus is shifting to the health sector, a topic that's making the headlines and raising concerns worldwide is Mpox. That is formerly known as monkeypox. It has been declared a global emergency by the World Health Organization. And today, I have with me the spokesperson, World Health Organization, joining us via Zoom. He is in Geneva, the WHO headquarters. He is TARIK JASAREVIC. Good morning, TARIK. Yes, I want us to begin with the global concern, but before we do that, let me quickly run a video of the WHO DG and the chairman emergency committee so that the people will have a view and understanding of what we're talking about. That'll be a brief one. So let's quickly take this video of the WHO DG on Mpox.
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. As many of you who tune into our regular press conferences know, WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something that should concern us all. Last week, I announced that I was convening an emergency committee under the international to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not been Mpox, and the potential for further spread is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The emergency committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more. For example, we're providing
World Health Organization Director General. And now I told you earlier on that I have the WHO spokesperson joining us via Zoom. He is in Geneva. TARIK is here with me. So TARIK, good afternoon.
Good afternoon.
Yes, let's begin with the global situation of Mpox now, and I want you to tell the people if it can be controlled.
Well, first of all, Mpox can be controlled. Like any infectious disease, there are basic public health measures that should be put in place so we stop transmission chains. And it's really simple. We just need to know where the virus is and who is infected, and make sure that the infected person does not infect anyone else. For that, countries need a strong surveillance system, countries need testing, countries need capacity to provide clinical care, and to use all available tools, contact tracing, surveillance, vaccines when appropriate, so it can be controlled. We have declared this upsurge of Mpox as a global health emergency last week, because we have seen a really worrying increase in number of cases, especially in the Democratic Republic of the Congo, but also neighboring countries. We have 4 countries that reported cases in just a few weeks. And what is also worrying is that there is a new subtype of Mpox virus that is being reported by all these countries, and now we are seeing this new subtype being reported outside Africa as well. Broadly, there are 2 clades, what we call clade 2. Traditionally, clade 1 was circulating in Africa, but now we are seeing a modified version of clade 1, now we call it clade 1b, that it's transmitting very fast, and we are trying to understand this clade a little bit better, but we need all countries to be on alert, and this is why we declare global health emergency.
Well, thank you, Tarik. Another issue is, I saw one of the videos where you said there is no need for border closure at this moment, and a lot of people are worried. The rate at which the people are migrating from one country to the other, do you still think there is no need for border closure? Don't forget, Sweden already recorded few cases thereabouts. So what do you have to say about that?
We are not recommending any travel restrictions. We have seen, as recently as with COVID-19, that you cannot really stop the virus at the border, and closing down society is not really the option to stop transmission. What we need really is to have a targeted approach to know where the virus is and to stop transmission chains, where they are. Now, Mpox is not transmitting as easily as COVID. It's not as much as we know at this stage. It's not transmitting through aerosols and droplets. So you need a very close skin-to-skin contact with infected person. So what is really needed is to try to identify infected people, provide them with a supportive care, and make sure that the communities around know how to protect themselves and not get infected.
All right. Now, $1.5 million has been released so far to some countries, from donations. What is the WHO doing to monitor to ensure effective judicious use of this money?
Well, we are working with all countries, especially with affected countries, on how best to support them, whether it's in terms of technical support when it comes to capacities of surveillance, of contact tracing, or community engagement. We are also working with producers and manufacturers of 2 vaccines that are recommended to use in a targeted way. So just to be clear, we are not recommending mass vaccination. Vaccines are recommended only for groups that are of a high risk of exposure in outbreak settings. So we are working with producers to put in place mechanisms so countries that need these vaccines can access vaccines through the mechanisms that already exist. So we will continue to do so, but again, what is really important to say here is that many countries have increased their capacity during COVID-19 pandemic. We know that many countries have now laboratory capacities, they have surveillance capacities, they have many better clinical care, and we need to use this infrastructure that has been built during COVID-19 to be able to address any other pathogens, in this case Mpox. And I think this is the lesson we got from pandemic, that we need strong health systems and we need international cooperation. So, and this is why countries are negotiating since COVID-19 what we call pandemic treaty, so convention that would put in place mechanisms we can collectively use when it comes to global health threats. Mpox is just another example where we need this cooperation and where we need to have strong health systems, and really basically it comes down to investing in health.
Yeah, thank you. Now, you mentioned the word vaccine now. Let's talk about vaccination. Are people still making use of that of smallpox, or there is a special one for Mpox?
So there are 3 vaccines that are being recommended by W.H.O. To provide some level of protection. Now, Mpox is of the same family of viruses, orthopox viruses, as the smallpox. So people who have been vaccinated with a smallpox vaccine have already some level of protection. Even after eradication, there was a work on developing new and better vaccines against the smallpox that can be used and that are for Mpox. So there are especially 2 vaccines, NBA, BN, and LL16, that are basically recommended to use, but only in an outbreak setting, so not for the mass vaccination. We need really now to make sure that those vaccines, to see how we can ramp up the production with the manufacturers and how countries can access. There are mechanisms for that. WHO has started our part, what we call emergency use listing, to get the data from the manufacturers to make sure that vaccines are efficient and safe, and then to see how countries can access these vaccines.
Now, if those that are vaccinated with a smallpox vaccination, you said they are safe. Why is there a surge this year compared to that of 2022? What was left undone?
Well, if we compare 2 outbreaks, you will remember that we declared global health emergency in 2022. But that was, and I was talking about clade, so that was really global outbreak of clade 2, that is less severe, and that was primarily being transmitted through a sexual route in a particular sexual networks. Now we are seeing clade 1 that is more severe. We are also seeing that children are affected. And one of the reasons why children are more affected is because they have not received that smallpox vaccine, like many of us did when we were children. And that provides a level of protection, and these newer vaccines are even better. We are just trying to collect the data to make sure that we know exactly the level of protection and how these vaccines should be used. Should it be used after the exposure, how long it takes to develop antibodies. So all these things are being worked on. But vaccines that exist and that I mentioned are safe to use and have already been used in the outbreak in 2022.
Okay, now there is the Mpox is animal to human transmission. Now, should there be fears of human to animal transmission? Is that possible? What can be done to guard against it?
Like many viruses, this is a zoonotic virus, so it comes from the animal world. So a person can be infected with a contact with an infected animal, but what we have seen in 2022-23 outbreak, but even now, that the transmission is mainly human-to-human transmission through a close skin-to-skin contact. So it's not as COVID was the case that it can travel through air and infect people, but rather you need very close contact with a person. If you share the household, so you are touching the same surface. If you have sexual relation, if you are touching the skin, a hugging person, so it really requires skin-to-skin contact, and that's why we are seeing the members of the same household being transmitting the disease or through sexual partners. But again, the viruses mutate. We have to really be very cautious and make sure that we look into evolution of the virus. So now we have this new subtype. We have to understand it better, and that's why it's important that countries have the laboratory capacity to detect virus, but also to do genetic sequencing, so we get this information about any possible evolutions of Mpox.
Okay, let's round off with the impact for global health security. The impact of Mpox for global health security. Let's round off with that.
It is. We declared this global health emergency for all countries, and not only countries that are seeing cases, but all countries to be on alert. And this is what happened, for example, in Sweden on Friday, where Sweden was on alert, and they basically look out for people with symptoms that are consistent with the symptoms of Mpox. And that's skin rash, lesions on the face or genitalia, headache, fever. So countries have to be aware that this virus is circulating and that people are traveling. So it can travel in a matter of hours from one place on the planet to the other one. So to look for people who are coming from countries that have the virus circulating, people who have symptoms, to be very quickly tested. And if person is a confirmed case of Mpox, to know with whom this person was in close contact with, so to find these people, to check on them, to make sure that this person is provided with the necessary clinical care, and also that this person does not really infect anyone else by avoiding close contact with others. So this is really basic public health response of trying to break transmission chains.
Okay, thank you, Tariq. But is there another non-African country that has recorded cases apart from Sweden?
Well, we have the 22-23 was a global outbreak with a clade 2. Sweden was the first country outside Africa to identify this clade 1, and we are also. I just read a report from Thailand. We still have to check on that to receive the full information. But again, the viruses don't really recognize any borders.
Yes. Thank you so much, Tariq, for your time.
Thank you.
Yes. That was TARIK JASAREVIC, the WHO spokesperson. We'll take a short break now. When we come back, my second guest, a medical doctor from the United Kingdom, will join us. So stay with the People's Daily, OGTV. I'll be right back.
Training health workers and supporting clinicians to provide appropriate care. We're supporting countries to access vaccines and develop the strategies to roll them out, and much more. To fund this work, WHO has developed a regional response plan requiring an initial $15 million. We have released about $1.5 million from the WHO Contingency Fund for emergencies, and we plan to release more in the coming days. We're also appealing to donors to fund the rest of the response plan. WHO is committed in the days and weeks ahead to coordinate the global response, working closely with each of the affected countries and leveraging our on-the-ground presence to prevent transmission, treat those infected, and save lives.
The current outbreak of Mpox, upsurge of Mpox, is an extraordinary event in view of the fact that we're having the highest number of cases ever reported in the DRC, for instance, since the outbreak was reported in the 1970s, especially 2024, a very significant upsurge in the number of cases. The fact that children, the vulnerable children, pregnant women are also impacted, and a number of mortalities have been reported. Secondly, the emergence of a completely new strain of
Welcome back. I have joining me via Zoom from UK now, Dr. OLULADE. She will tell us what efforts are being put in place to stop the spread or transmission of Mpox. Good morning, or good afternoon.
It's still morning.
It's still morning, yeah, good morning. Now, glad to have you join us. Let's talk about your own understanding of Mpox and what has been efforts being put in place to stop the transmission. You know, now that Sweden has recorded a case, a non-African country.
Okay, so first, Mpox is a viral infection. It comes from a family of pox viruses, and commonly the first viral case was isolated in Africa, in now what is called the DRC. And usually when we hear of cases of Mpox, it's usually around Central Africa and Western Africa. We've isolated about 2-3 different strains of the pox virus itself. But now we are in a situation where the disease has moved from being transmitted from just animals to human hosts, but now from host to host. So that's why we're seeing it spread just from that region, but we're seeing it in other countries. And right now, most of the preventive efforts put in place include education. So we're letting people know what the virus is all about, how it can be transmitted, what needs to be done if you find out that you have symptoms related to the illness. We're reassuring people also so as to prevent spread of fear amongst people. And then apart from that, with the information out there, there are also talks of vaccinations going on for people at risk, not just for the general public, but for people at risk, which would include children, pregnant women, and people that have suppressed immune system. There are also other treatments on the way, antiviral medications considered for those at risk that have been infected, but then all of that is still in a development phase because I don't know if you're aware, but Mpox itself doesn't have a cure. And the vaccines that we're using, to protect people is not directly for Mpox, but actually against smallpox. But because the virus comes from the same family, it works to serve as a means of protection for people. Also, like I said, the key thing is education, informing people that they have to keep their hands clean. They have to try as much as possible to not be in prolonged contact with people that have symptoms or people that we've identified to have the infection, because we've discovered that it's not spread the way other viral illnesses are spread in terms of aerosol droplets from coughing and sneezing. It's more of due to prolonged contact. So touching the person, coming in contact with the blisters.
Okay, Dr. OLULADE, sorry to cut you short, but I want you to take a look at what the WHO said, that there is no need for closing the borders. What is your take on this?
Well, yes, I do agree that there's no need to close the borders. Why? Because it's because of the route of transmission. So there are two major routes. There's the route from human to human, which requires prolonged contact. Now, unless you are going to be seated close to a person that has symptoms for a prolonged period of time, and I'm talking hours, not minutes or seconds, that we would see from people that are just moving into a place and moving out, it's not sufficient. That time frame is not sufficient to allow exposure. The exposure for it to be able to get the illness, it's in hours. Okay. So you need to spend quite a bit of time with the person.
Is there need for nose mask then, like in the time of COVID?
As of now, no.
Okay.
There's really, the only people that require nose masks and protection suits, the nets, and the coats are people that will be in charge of the care of these people, because they will be in constant exposure to these people. So the nurses, the doctors, because they will always have to contact them, meet with them. And if you are a caregiver to someone who's refusing to go to the hospital, and you have to maybe feed them with food, look after them, then you read that. But for the general public, no.
Okay. All right. Thank you so much for your time, Dr. OLULADE. It's nice having you on the program. Yes.
You're welcome.
Yes.
Thank you very much.
Yes. Now, we have actually come to the end of the program, International Desk, for this week. Many thanks to TARIK JASAREVIC, the WHO spokesperson who joined us via Zoom. And many thanks too to Dr. OLULADE from the UK. Thanks to you too for being a part of the program. Do join me same time next week for a fresh episode. Goodbye.